Happy Wednesday. From the series of prostate cancer, today I want to talk about symptoms and diagnosis. Some patients come and complain of difficulty starting the urination, weak or interrupted flow of the urine, pain or burning sensation when they are urinating, increasing the frequency of urination, especially at night, or the presence of blood in urine or their semen. So looking at these symptoms, it reminds us of some other pathological conditions. For example, urinary tract infection also might cause some of this complaint. Or for example, we know that with aging, there is an increase in the size of prostate, which we called it BPH or benign prostatic hyperplasia. They also have this kind of complaints or symptoms. So it's very important that we educate patients about other symptoms that might be kind of red flags, mostly toward prostate cancer. For example, if patient feels fatigue or tired during the day, if they are anemic, if they have an unintentional weight loss recently, or for example, if they have chills or night sweats. So some of these symptoms might alert us that it's important we do more investigation to prostate cancer. So my recommendation is that anytime that there are some urinary related symptoms, as I explained here, especially if the age is over 55 years old and there is a positive family history of prostate cancer in the family, I really recommend that you see your doctor and do more investigation toward ruling out prostate cancer. So for diagnosis, there are some different diagnostic laboratory tests that it's done. One of the very common one is PSA or prostate specific antigen. This marker is not very specific for prostate cancer. It might also increase in, for example, inflammation and infection of the prostate, even with recent ejaculation, with vigorous physical activity. Even in patients with BPH, PSA might be a little bit higher. So it's not a very definitive markers for prostate cancer. That's why that there are other markers, the other blood tests, and other approaches that usually your surgeons or family doctor or urologist might refer you to do more tests, like for example testing for PSA velocity, or for example different components of PSA, checking free PSA versus bound PSA, or for example doing some other very specialized test for prostate. So this was an overall of the symptoms and some diagnostic approaches. So in the next video we will talk a little bit about conventional treatment.